So then can you explain to me the difference between coverage and actually being treated? How are we going to pay for this?
I'm sorry, coverage and...
Between coverage and being actually treated, how will we pay for this?
Well, I'll give you an example of coverage. And I spoke to a farmer a couple of weeks ago who told me that his policy is a $10,000 deductible. He is considered insured. But the reality is that though he is considered to have health insurance and to be covered, he really doesn't have, for all practical purposes, for most things, except for a catastrophic accident, which is fairly dangerous on a farm and typical, they would not be covered at all. The other thing is that a woman testified before my committee, Robin Baton, 55 years old, who was a nurse for 30 years. She had health insurance, pretty healthy, retired, started her own small business, got a Blue Cross Blue Shield plan in Texas. And then she was diagnosed with aggressive form of breast cancer. Well, the Friday before the Monday she was supposed to have her surgery, they called her and they said, no, they're going to do a review of 5 years back of all of her medical records. To make a long story short, they ended up canceling her policy, rescinding it, back to the day that she had signed up. She got sick. They decided that she would not be covered any longer. By the time 7 months later, her congressman actually got her to be able to have her surgery, the tumor had doubled, it went into her lymph nodes. She came and testified and was very sick. Coverage does not necessarily equate to health care. We have to bring those two together.